You wake up and for the first few minutes everything is still blurry. You blink a few times, expecting it to clear the way it used to. It takes longer than it should. At night you grip the steering wheel a little tighter because the headlights from oncoming cars spread into halos you cannot quite see through. You squint at a menu across a restaurant and accept that you will just order what you always order because reading it has become too much effort. You have been told this is simply aging. But the research suggests something more specific is happening inside your eye tissue, and some of it is addressable through what you eat in the evening hours before sleep. If this channel has ever given you something worth knowing, hit that subscribe button right now, leave a like, and drop a comment below, because that is what keeps this kind of conversation reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health, simplified and designed for adults over 60. Stay with me through this entire video, because by the end you will understand the 4 specific biological processes driving age-related vision decline, which fruits contain the compounds that directly address those processes, and how to consume them in a way that actually delivers those compounds to the tissue that needs them. Let's begin with what your physician rarely explains in detail about what is actually happening to your eyes after 60. Your retina, the light-sensitive tissue lining the back of your eye, contains specialized cells called photoreceptors that capture incoming light and convert it into the electrical signals your brain interprets as vision. These cells are extraordinarily metabolically active. They consume oxygen and nutrients at a rate exceeded by almost no other tissue in the human body, and critically, a disproportionate amount of the retina's repair and regenerative activity occurs during sleep, when the body redirects resources toward tissue maintenance. A study published in JAMA Ophthalmology in 2023 confirmed what researchers have been observing for years. Age-related retinal damage often begins with 2 simultaneous and largely silent processes: oxidative stress accumulating in the photoreceptor cells, and chronic low-grade inflammation in the retinal tissue and the tiny blood vessels supplying it. Both processes are most active during the overnight repair window, precisely when the retina is attempting to do its most important maintenance work. What makes this clinically significant is that it means the evening nutritional environment your body brings into sleep directly influences how effectively retinal repair occurs. Let me now walk you through the 4 specific biological mechanisms driving vision decline in older adults, and the fruits that the evidence associates most directly with supporting each one. The first mechanism is oxidative damage to photoreceptor cells. Your retina is exposed to continuous light stimulation throughout every waking hour, and that stimulation generates a constant flow of free radicals. The retina has its own antioxidant defense system, anchored by 2 specific carotenoids called lutein and zeaxanthin, which act as internal biological filters in the retinal layers, absorbing harmful blue light wavelengths and neutralizing the free radicals generated by light exposure. After 60, the concentration of lutein and zeaxanthin in the macula, the central zone of the retina responsible for sharp detail vision, declines progressively. As that protective layer thins, oxidative damage accumulates faster than the retina can repair it. You notice it as increasing difficulty with fine detail, text that requires more light than it used to, and a general dimming of visual clarity. Golden kiwi fruit is one of the most accessible and well-studied dietary sources of lutein. A study published in the Journal of Nutrition and Healthy Aging found that older adults who consumed 2 golden kiwis daily experienced measurable improvements in visual sharpness alongside reduced morning dryness and eye redness. The dose is 2 golden kiwis, not green, consumed approximately 1 hour before bed. Golden varieties carry more lutein, produce less gastric acid, and are more comfortable for an older digestive system in the evening. When eating them, scoop the flesh with a spoon rather than peeling aggressively. The layer of flesh immediately beneath the skin contains concentrated caffeic acid, an additional antioxidant compound that is lost with aggressive peeling. I had a patient I will call Marguerite. She was 69, had been struggling with dry, scratchy eyes every morning for over 2 years and found her vision slow to clear after waking. Her ophthalmologist had recommended artificial tears and monitoring. When we discussed her dietary pattern, her intake of lutein and zeaxanthin from food was negligible. We introduced 2 golden kiwis each evening as a consistent habit. At her 8-week review she described her morning eye symptoms as significantly reduced and her morning clarity as noticeably better. No prescription changed, no procedure performed. The second mechanism is glycation. one of the most underappreciated processes in age-related vision deterioration. Glycation occurs when excess glucose in the blood binds to proteins in the eye tissue, progressively forming compounds called advanced glycation end products. These compounds cloud the lens, degrade retinal proteins, and over time contribute to both cataract formation and macular damage. Papaya is the fruit with the most direct evidence for addressing this mechanism. It contains papain, a naturally occurring enzyme with documented protein-modifying and anti-inflammatory properties. It also delivers a combination of vitamins A, C, and E alongside folate, nutrients consistently associated in the research with tear film stability and retinal protection. A study published in Clinical Gerontology in 2023 found that older adults who consumed papaya in the evening showed lower levels of glycation markers at follow-up alongside stronger tear production and measurable improvements in contrast vision within 6 weeks. The recommended amount is 1 cup of ripe papaya cubes approximately 1 hour before bed. Temperature matters here in a way most people do not consider. Cold temperatures suppress papain enzyme activity. Remove your papaya from the refrigerator 30 to 60 minutes before eating so it reaches room temperature, allowing the enzyme to remain functionally active when consumed. Squeeze fresh lime juice over it before eating. The vitamin C in lime meaningfully improves your body's absorption of the fat-soluble vitamin A in papaya. Do not combine with dairy at the same meal, as calcium proteins bind to some of the fruit's active compounds and reduce their absorption. The third mechanism is retinal microinflammation and reduced blood flow to the optic nerve. This is the process that causes halos around headlights, difficulty adjusting from bright to dim environments, and progressive strain in low light conditions. It is driven by chronic low-grade inflammatory activity in the small blood vessels supplying the retina and optic nerve, combined with reduced vascular flexibility that diminishes oxygen delivery to these structures during sleep. Black currants are the fruit with the most targeted evidence for this mechanism. They contain an extraordinarily high concentration of anthocyanins, the deep purple pigments that in the eye simultaneously reduce inflammatory signaling, support blood vessel dilation, and help restore rhodopsin, the visual pigment responsible for dark adaptation. A randomized placebo-controlled trial involving glaucoma patients found that 50 mg of black currant anthocyanins daily over 24 months significantly improved blood flow to the optic nerve and meaningfully slowed the progression of visual field loss compared to placebo. A separate pilot study found that black currant anthocyanins increased retinal blood flow without affecting intraocular pressure, suggesting a neuroprotective potential relevant even for individuals without a diagnosed eye condition. Because fresh black currants are difficult to find in most markets, a standardized black currant anthocyanin extract at 50 mg taken in the evening is the most practical option. Pair it with a small amount of healthy fat such as a few walnuts, as the anthocyanins are better absorbed in the presence of fat. The fourth mechanism is macular thinning, the progressive degradation of the macula's protective pigment layer that underlies age-related macular degeneration, the leading cause of central vision loss in adults over 60 worldwide. Zeaxanthin concentrates specifically in the macula and provides targeted protection to this critical zone of the retina. Goji berries are among the most concentrated natural dietary sources of zeaxanthin available. A study published in Nutrients in 2021 followed adults aged 60 to 80 who consumed dried goji berries 5 days per week for 90 days. The results showed a significant increase in macular pigment optical density, a direct measure of macular protection, and no participant showed further macular degeneration progression during the trial period. 2 tablespoons of dried goji berries soaked in warm water for 10 minutes, then consumed approximately 30 minutes before bed. Soaking softens them and improves digestibility, which matters in older digestive systems. Pairing goji berries with a small square of dark chocolate containing at least 85% cacao is not an indulgence but a nutritionally supported strategy. The flavonoids in high-quality cacao have been shown to enhance zeaxanthin absorption, creating a synergy that delivers more of the compound to the macula than either food provides alone. Before I give you the complete action plan, I need to say something clearly and without qualification: the dietary interventions described in this video are supportive measures based on published research. They are not a treatment for diagnosed eye disease and they are not a substitute for professional eye care. If you are experiencing new vision changes, sudden blurry vision, visual disturbances, floaters, or any symptom that concerns you, see a licensed eye care professional promptly. Do not delay that evaluation based on anything in this video. For adults managing glaucoma, macular degeneration, diabetic retinopathy, or other diagnosed conditions, any dietary changes should be discussed with your ophthalmologist or optometrist, as specific conditions may have particular nutritional considerations that differ from the general approach described here. Additionally, if you are taking blood thinners or anticoagulant medication, discuss the addition of concentrated anthocyanin supplements such as black currant extract with your physician before beginning, as anthocyanins can have mild effects on platelet function. Now, here is the complete protocol built from the evidence. A patient I will call Bernard illustrates how this works in practice. He was 72, had been dealing with progressively worsening night vision for 3 years, described a persistent halo effect around lights, and had been told by his optometrist that his visual changes were age-related and no treatment was indicated. We reviewed his diet together. His evening meals contained almost no fruit, essentially no lutein or zeaxanthin, and no omega-3 fatty acids. We introduced a structured evening fruit protocol aligned with the mechanisms described above. At his 3-month optometry review, his practitioner noted measurable improvement in contrast sensitivity and dark adaptation testing. Bernard described driving at night as manageable again for the first time in 2 years. Here is exactly what to do. Step 1. Introduce 2 golden kiwis eaten approximately 1 hour before bed every evening as your baseline lutein and zeaxanthin source. Scoop with a spoon. Do not peel aggressively. Do not combine with dairy within 90 minutes. Step 2. 3 to 4 evenings per week. Replace or supplement the kiwis with 1 cup of room temperature ripe papaya with fresh lime juice squeezed over it, specifically targeting the glycation mechanism. Remove it from the refrigerator 30 to 60 minutes before eating. Step 3. Add 2 tablespoons of warm water-soaked dried goji berries with a small square of high-quality dark chocolate 4 to 5 evenings per week, to support macular zeaxanthin density. Step 4. At your next eye appointment, ask your practitioner specifically whether your macular pigment optical density has been measured, whether your lutein and zeaxanthin dietary intake has been discussed as part of your eye health plan, and whether any of your current medications affect intraocular pressure or retinal circulation. Step 5. Ask your general practitioner or ophthalmologist whether a dietary antioxidant intake assessment would be appropriate given your current visual symptoms and whether any supplement level intervention, specifically lutein at 10 mg and zeaxanthin at 2 mg daily, which is the dose studied in the Age-Related Eye Disease Study 2, or ARDS 2, would be relevant for your individual situation. One important clarification before we close: the fruits and protocols described in this video are most likely to be relevant for adults experiencing the gradual, progressive visual changes associated with normal aging, specifically increasing difficulty with fine detail, slower dark adaptation, morning dryness, and mild halos in low light. The evidence for dietary intervention is most consistent in the context of prevention and early-stage decline. For adults with moderate to advanced macular degeneration, established glaucoma with significant visual field loss, or significant cataract requiring surgical consideration, dietary changes alone are unlikely to be the primary intervention and should be discussed within the context of a comprehensive treatment plan with your ophthalmologist. The research supports diet as a meaningful complementary strategy. It does not support it as a replacement for clinically indicated treatment. Your vision is not simply declining because time has passed. In many cases, specific and identifiable biological processes are driving that decline, and some of those processes respond to what you give your body in the hours before sleep. That is something you have more influence over than you may have been told. If this video gave you something useful, hit the like button right now. Leave a comment telling me which of these 4 fruits you plan to introduce first and what vision improvement you most want to experience, and share this with someone you care about who has been told their vision decline is simply something to accept. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.